The biggest challenge with bipolar disorder and bipolar depression especially is recognizing it, is identifying it. It just often gets missed, especially in the primary care setting. We're so geared to screening for depression. We ask questions about depression and look for diagnostic criteria for depression, and depression is just one pole of bipolar disorder. The up pole, the up mood, the happy grandiosity, I can do anything. People don't complain about that. People don't complain about feeling good and getting a lot of things done. And so if we don't ask the questions, if we really don't go after it, we don't know that they're bipolar. We just think they're depressed. And that's the biggest challenge, is actually making the right diagnosis. Once you know what's wrong with someone, then we know how to treat it. It's getting the right diagnosis. I don't have a statistic for you in the primary care setting, which is where it is typically misdiagnosed, but I would guess conservatively at least half the time, at least 50% of the cases. Because as I say, when people come in with complaints, it's depression. They're complaining about depression. And primary care providers they're conditioned to evaluate for depression. And if the patient meets criteria for depression, they treat them for depression. But bipolar is a very different disorder, and they don't usually respond to antidepressants. So I would say easily at least half the time they are misdiagnosed. So the thing about bipolar depression is we treat it with mood stabilizers and antipsychotics. And the challenge with those medications always is it's not that they don't work, they do work. It's just that the side effects are intolerable and people don't want to take them, and so they stop taking them. So really the trend in developing new medications is trying to find those that are effective but don't have such a profound side effect profile that people give it up. And there are newer drugs on the horizon. It seems like all the time I'm hearing about new antipsychotics. So yes, they are coming.